Hi, my name is Victoria Mendez, and this Powtoon will be on mental retardation. The part of the brain that has been associated with intelligence is the frontal lobe. Specifically, the prefrontal cortex has been determined as the mechanism of the brain that allows for higher cognitive level functioning. When it comes to mental retardation, some causes may be due to physical head trauma, genetics, such as in the case of Down syndrome, maternal substance abuse, or severe malnutrition. Some key characteristics to look out for that children with mental retardation may display are speech and language problems, categorized by simpler sentences and the delay in learning how to talk, the need for literal comprehension, which leads to the inability to understand complex concepts, slow learning in an academic setting, and attention or memory problems. Like mentioned before, some of the causes of mental retardation are due to genetics, maternal substance abuse, infection, metabolic problems, insufficient oxygen during birth, environmental toxins, severe malnutrition, and head trauma. When these things occur, the cognitive damage that is done is permanent. That means it can only be managed and not cured. People who are classified as mentally retarded have a below average intellectual ability. One way of assessing mental retardation is through taking an IQ test. An IQ less than 70 is deemed as mentally retarded. Looking for other symptoms during childhood is also important, even though in most cases a child can be identified as having a mental disability shortly after birth. When treating mental retardation, one must keep in mind that the prognosis is permanent and it is incurable. However, some treatment options that can help manage the disability and improve the individual's overall cognitive functioning are speech and language therapy, occupational therapy, and entering into special educational programs. An individual with a mental disability is faced with limitations in everyday life. Some functions that they cannot perform effectively include reasoning and learning, and even learning complex subjects like math, or even having social interactions with their peers and getting dressed in the morning by themselves. Considering the treatment options that were listed, speech and language therapy can be the most effective. The individual is able to slowly learn how to communicate better and expand their vocabulary. However, other techniques are just as important, such as helping these children feel like they blend in and have a sense of belonging. And in the classrooms especially, the attention a child receives is pivotal to their educational years. Though individuals with mental retardation cannot reason or perform higher level of cognitive functioning, they can still have a relationship with Jesus, which I think is amazing. Matthew 18:3 says, "Truly I tell you, unless you change and become like little children, you will never enter the kingdom of heaven." The most important part is that these children can still have faith in God. Thank you so much for watching my Powtoon. I hope you enjoyed.